Hi there, I'm Lucy McDonald, physiotherapist. Welcome back to my virtual clinic. Today I'm going to be talking to you about pain at the base of the skull, so pain at the very top of the neck. What causes it, what exercises you can do to help it, and when it is that you need to go and see a doctor about it immediately. But before I do move on to those things, I want to say thank you so much, as ever, for all your lovely messages of support. I really do appreciate them. So, pain at the base of the skull, what could be causing it? Well, if I introduce you to Bob, Bob is a plastic model of the spine, and if we go to the top of the spine and we have a look at the neck, what you can see is that the vertebra, so the bones in the top of the neck, become smaller and smaller, and you can see that your skull sits on the top there. Now, the junction between the skull and the rest of the neck is a really important place where lots of muscles insert, and as the muscles insert into the bone, they turn into tendons. So that there's this big band of tendinous tissue that runs all the way across that base of the spine, and therefore it's a really common place for people to feel tension or soreness, pain and stiffness. Now, it's also worth bearing in mind the other structures in that area. So you've got lots of ligaments, lots of little joints, the facet joints down the sides and the discs in the middle, if we can see them a bit more clearly in the front there. You've got all those joints, and then you've also got these yellow things which are nerves that come out of your neck, supply your head and your arms, and likewise blood vessels that supply the region as well. So it's really important to bear in mind those things when you've got soreness in there. So what is commonly causing the problems in that area? It's often to do with doing too much of one thing. So most commonly sitting, and also nowadays looking down on our laptops or on our tablets or smartphones. So those sorts of things will contribute, but obviously if you've got a job where you're looking down a lot, or even conversely if you're a decorator, for example, and you're looking up a lot when you're working, any prolonged position of the neck, the neck is not going to like it. So some of those things you'll be able to modify yourself, and if you can, please do. And unfortunately, some of them you just won't. So I'm going to be showing you in a minute some exercises that you can do to alleviate your pain. Now, before I move on to those, it's really important that I run through a few things, because if any of these things apply to you, you must go and see a doctor immediately. So if you have had any kind of traumatic accident, so for example, if you've been in a car accident or you've fallen and you have got neck pain as a result, then you absolutely must go and see a doctor, because there might be a possibility that you might have a small bone fracture in there that needs attention immediately. Also, if your pain has come on gradually for no particular reason and your pain doesn't respond to any difference in movement or position, it's just a nagging pain that's constantly there and it's been going on for a while, then that's another reason that you should go and see your doctor, and especially, but not only, if you are getting pain at night, it's waking you up. So other things that you need to watch out for if you're getting any problems with things like your speech, so particularly the articulation of words, with swallowing. If you have any visual problems, double vision, but any visual problems, any ringing in your ear, any dizziness, any fainting, blackouts, and then things and nausea. And then other things like if you have pins and needles in both of your hands, or a reduced sensation in both arms or legs, it's really important that you go and see your doctor immediately. If the symptoms have come on suddenly and or the symptoms are getting worse very quickly, then you need to go to your emergency department. So go and see a doctor as an emergency. Right, all those things aside, I'm now going to show you some exercises that you can do to alleviate the pain in the base of your skull. So the first thing that I want you to do is just some nice gentle movement. So first of all, the twisting motion of the neck can really alleviate all of that tension. So just very gently, you're going to turn your head all the way around to the side and give it a little push, and then all the way around the other way and give it a little push. Now, it's highly likely that you won't have the range of motion that I have, but if it's literally just a small amount of movement and then a little push and then likewise the other way, then that's fine. It's all about doing it little and often. So if you can do about 10 repetitions every couple of hours, then that will that will ease things for you. The next one is just a gentle chin down to your chest. So again, take your head forwards and with your hands, gently apply a little bit of pressure to your head, just gently stretching out the back of your neck. Last but not least, it's all about your neck posture and your shoulder posture. So often all those muscles that I talked about at the beginning, a lot of them come from or attach near or around the shoulders and the ribs. So it's really important that you get your shoulders and your neck and your head in the correct position. Most commonly, again, because a lot of us are often sitting at our laptops or computers or on our smartphones, we can end up in quite a slumped position. So the first thing to do is just to correct that position by lifting your breastbone up, your chest bone up, to correct that upper back posture. Then bring your shoulders up and back slightly and tuck your chin in, elongating at the back of your neck. What you mustn't do is yank your shoulders back and pull your shoulders down, because that will make your neck pain worse. And I've seen that many times, people trying to correct their posture by pulling their shoulders too far back and too far down. If you're not sure of how to do that, I have a video. If you go onto the Octopus Clinic website and you go into the search tool and you put neck posture at the top, you will see lots of videos talking through in great detail how you can correct your neck, head and shoulder posture. So I'd strongly recommend that you do that. In fact, in that section of the website, you've got a whole range of exercises for your neck and shoulders. So I hope that's helpful. My last and final tip is actually to focus on your breathing. Now, surprisingly, a lot of those muscles that attach into the base of your skull attach into the upper ribs as well as the shoulder. So it's a really good idea to try and focus on breathing from your diaphragm. You can go back through these videos and see specific videos that I've made on breathing from the diaphragm. But basically you place your hands on your upper abdomen and you just practice gently breathing from there, trying to draw the air out, push the air out of the lungs, and then let the air come back in, breathing from this region to try and reduce the amount that you're breathing from your upper lungs and ribs. So I hope that's been helpful. I will do my next video on pain lower down the neck, so please do come and join me for that. Please do press the big red subscribe key and let me know what you would like me to do a video on next. Bye.